Hello students, welcome to Beautiful Mind IS. I am Arun Kumar. Here is a question that has been asked in Civil Service Examination 2022 Psychology Optional Paper 1. And the question is discuss the technique to assess patient with memory disorders. 5D 10 marks. Question is simple, straightforward, but you may find difficulty in framing answer. Why? Because it says the technique to assess patient with memory disorder. See, memory disorder comes in various forms, be it prosopagnosia. It is what? So inability to recognize face of individual, Alzheimer disease, Korsakoff syndrome, where you are not able to, uh, recall things from past or sometimes form new memory, and of various kind. But if you categorize all those things into these memory disorders, as you know that memory disorders are not simple forgetfulness. Simple forgetting is just because of the lack of irritable cues and many other factors, but it is a disorder caused by some brain damage, maybe stroke, maybe lesion area, damage in some area, maybe. So memory disorders is a different thing. Not it is a normal forgetting. This is not normal forgetting. So how to assess? What techniques should be? I have seen answer of many individuals. They are emphasizing what is memory disorder. So okay, in the context you can write, but the question is that what discuss the technique to assess. So what techniques you will use? If you categorize the things, memory disorders into form, one is anterograde, inability to form new memory, another is retrograde, inability to recall from things from the past. But what techniques you will use? One is the method that has been used by Ebbinghaus, simple recall method. You know this thing that something is shown and then you will be able to you will be required to produce the things in whatever order you want. So recall, it could be sequential or it could be free recall. Second type is recognition test. Recall test is where you are not given any cues or hint. Recognitions like you find in MCQ, there are 4 options and now you need to recognize. When eyewitnesses are tested, then parades is there and they are asked to recognize the face. Likewise, patients suffering from prosopagnosia, they are asked to recognize the face, known face. Alzheimer, they are asked to recognize the person from the family member also. So these are the things. So recall, recognition, and sometimes patients say that I am not able to recall, I do not have any memory. But when other techniques are used, they show some saving, and that's called saving method. And the technique used to understand this saving is relearning. Relearning means, suppose you have learned something and after a long time, suppose you have forgotten. When you are say that, have you seen this thing, this name in the list or no? And now again, so you have learned that list before, many year ago, many month ago, many week ago, whatever. But now you are not able to, recall that whether you have gone through this kind of thing. Now, when same list you require to learn, then you take less time. Relearning is faster, and that also is an indirect measure of memory. So, memory disorders. So, why this could be used for patient with memory disorder? Yes, because procedural memory is measured through this way. But they are given some task, performance, for example, playing piano, and then how much time person takes to perform on that, and then next time whether that performance improves or not. If there is improvement in performance, that is say that person is having some memory trace and that is benefiting. So indirect method is there, indirect method of testing memory. So patient having kind of things we have seen with HM, KF case studies, neuroscience case studies, and of similar kind, many patient with other disorders, memory disorder, they are tested this way. So explicit memory, say recall, recognitions, implicit memory or explicit memory, recall, recognition and relearning. Implicit memory, indirect method like relearning, performance, getting this one, and priming. That suppose you have shown something, person is, suppose I have given that example several times, that you have seen computer and many other things. Next time something are there, that is word is mutilated, शब्द जो है टूटा फूटा है, उसके अल्फाबेट्स इधर उधर हैं, you are asked to make up some word, then person makes up that no more likely those who have been primed, जिन्होंने कंप्यूटर वगैरह देखा है पहले, उस टेस्ट के पहले समय से, वो ज़्यादा उसको वो कर पाते. तो ये नॉर्मल एडल्ट में जाता है, लेकिन खास करके मेमोरी डिसऑर्डर वाले को टेस्ट तो इसी तरीके से किया जाता है, और जब स्कोर ख़राब आता है तो मानते हैं कि इनको यानी प्रॉब्लम है. HM के बारे में क्या था कि वो ही वॉज नॉट एबल टू फॉर्म न्यू मेमोरी. कैसे पता चला? पता तो इस तरीके से चला ना कि ही वॉज टेस्टेड. जब उसने बार बार एक ही न्यूज़पेपर को पढ़ रहे हैं, कुछ समय बाद फिर से कॉल के लिए रिक्वेस्ट कर रहे हैं बार बार, उनको याद नहीं हो रहा कि मैंने पहले कभी कॉल किया है, तो बाद में उसको टेस्ट किस तरह से किया गया कि ठीक है आप कितने समय के बाद उस चीज़ को करते कि नहीं, तो टेस्ट लिया जाएगा कि ये आपने लॉन्ग टर्म मेमोरी टेस्ट किस तरीके से होता है. उसी तरीके से रिकॉल मेथड, रिकॉग्निशन मेथड, रीलर्निंग मेथड, तो हर तरह की टेक्निक यूज़ की जाती है. तो इसी को लिखना है यहाँ पे. एंड वैरिंगटन की टेक्निक यूज़ करेंगे कि नहीं, वो पर्टिकुलर चीज़ हो सकती है कि डिसोसिएशन, एक डिसोसिएशन टेक्निक है जिसको कहते हैं कि दैट यू मे अंडर परफॉर्म इन वन एरिया बट you may perform good in other areas. So I mean these two areas are different, and on the basis of this dissociation technique, many patients suffering from anterograde amnesia has been identified कि उनका जो परफॉर्मेंस है वो प्रोसीजरल मेमोरी पे बेहतर है. प्रोसीजरल मेमोरी उनका ज़्यादा अफेक्टेड नहीं हुआ, एंड सो कॉल्ड इम्प्लिसिट मेमोरी डिसोसिएशन टेक्निक्स. एंड जिसको वैरिंगटन जो है वो स्टडी करके बताया कि डिसोसिएशन होता है, उस इफेक्ट को डिसोसिएशन का. लेकिन उनका जो एक्सप्लिसिट मेमोरी है, यानी कि मेमोरी ऑफ जनरल कॉन्सेप्ट्स और सो कॉल्ड न्यू कॉन्सेप्ट फॉर्म करने में दिक्कत हुई, या मेमोरी ऑफ एपिसोड्स, है ना, नई चीज़ों के बारे में याद नहीं रहता. लेकिन एपिसोडिक और ये दोनों को मिलाकर हम एक्सप्लिसिट मेमोरी कहते हैं, इनमें दिक्कत होती है. लेकिन जो डिसोसिएशन टेक्निक है उसको उसमें दिक्कत नहीं होती दूसरे में. तो ये एक टेक्निक है. कुल मिला के इसी स्ट्रेटजी के 10 मार्क्स के क्वेश्चन, अगर आप इसको इन सब कंटेंट को यूज़ करके अगर अच्छे से आंसर करेंगे, देन यू विल बी एबल टू फ्रेम योर आंसर. थैंक यू. मिलेंगे अगले वीडियो में और बात करेंगे किसी और प्रीवियस ईयर क्वेश्चन पे. थैंक यू.